33-year-old female serving in the military as a neurosurgeon in Afghanistan. After suffering major damage to her frontal lobe from airplane failure, she discovers she suffers from hypoxia, an incurable mental impairment. After years of trying to cure and treat the mentally ill in the Army, Dr. Thompson comes to terms that they will never be cured from a torturous life ahead of them. Since she herself cannot have a normal life, no one deserves one. Thompson drugs her victims with paralyzing drugs, shoots them, and brands them with a tattoo. Soon, commanding officers became suspicious. Is she saving people from a harsh, treacherous life, or is it murder?
Guys, together. Now, we have two cases here. Someone open this file. This is victim 1 over here, victim 2 here, victim 1. Open up the all the little stuff we have, and we have to find what the similarities are here.
So I have a gunshot wound to the head.
Also, I have a gunshot wound to the head.
Okay. Any other body markings or bullet?
You have this infinity sign that you found on her back.
I also have an infinity sign
Where's that one at?
on the upper thigh.
Yeah,
Okay.
upper thigh, close to the gluteus maximus.
Alright, that's good. And then I have a picture of the room.
The room?
I have a picture of the crime scene and it has blood on a safety pin with a fly.
Right, so that blood matches up to our victim 1. And then this is where
The blood
victim
on here
2 was
matches
found.
up to, yep.
Okay.
Victim two.
And we
So
also
we-
have a murder weapon. Do y'all have a murder weapon?
No,
we
I
don't
did
have
not see
anything.
the weapon in the crime scene.
Alright,
No.
well this looks like a non-mil, so...
Alright,
Alright, so we have to get a scan of the bullets.
Alright, well then Keneal can take the autopsies, take that to the lab, find out if there's anything else in common in there. I'll do the blood, and does someone want to take,
I'll do the toxicology report.
alright.
Okay.
Alright.
I've noticed that both victims are in the same naval academy. We should probably get that checked out.
I think we might have a serial killer on our hands. 2 different murders, both same branding. We might have a repeat offender. Let's see.
Alright, here guys, here's more. I did the samples on the blood. They both do have a drug to them, so I don't know which exactly one that was, but I think that's what Caroline got here.
Toxicology report, and whoever's doing this is giving their victims a mixture of cocaine and prescription.
I took an MRI of my victim's brain, victim 1.
Victim two.
Do you have victim 2?
Alright, well, I'll inform you on what we got here. We have 2 blood samples, both the same from what Caroline has.
And a mixture of cocaine and prescription drugs.
Okay, and we found in common that both of them had brain injuries prior to being killed.
And someone said that they were part of what?
The Naval Nursing Academy.
Naval
Okay,
Nursing
so there
Academy.
is something, so maybe we should file it there. And talk to the, yeah.
Okay, we gotta find the doctor of that lab.
Who's gonna do that?
Kevin and Keneal?
Well, we'll do that once we get to the, okay.
Come in!
Hello, Mrs. Thompson.
Hello?
I'm Kevin and this is my partner Keneal. We just here to ask you a few questions.
Okay.
Okay, so both your patients has a type of brain injury. The first one was a diffuse axonal and the other was a concussion. Can you tell me more about that?
Just put my eyes.
The first one is Robin, and the next one is Kim.
What you need to know? More about their injuries.
Yes, and how these injuries.
Both women were in a roadside bombing during combat. Both of them suffered injuries to their brains, but both of them also recovered fine and are now still in battle.
Okay. Do these two have any connection otherwise than medical issues?
They both hang out with Sergeant Ford a lot. They don't know that they see him.
So they don't know.
And is Sergeant Ford one of your patients?
No.
No. Okay. That's all. Thank you for your time.
You're welcome.
I did some research while Keneal and Kevin left on victim number 1. She had diffuse axonal injury, and that's when like say a car accident or something, her head moves back really fast, like multiple times, and the axons in her brain had snapped, which caused her to like, the messages like not sent through, stuff like that.
And victim number 2, she had a concussion, and it's when like a really hard force hits the head, and she had like swelling in her head. And
Yeah.
she's bleeding.
And then the MRIs show like the areas that we've seen like the most axon snaps.
And then it's on MRI. We see a lot of the brain swelling, and we see some hemorrhaging.
Okay. So we got that. So we got our evidence, and we got the brain injuries that we can put together. Anything else? Did we find anything else, or is that it?
So now I guess we're just waiting for Kevin and Neil to come back.
Okay. And with the whatever they bring back, who's doing? What are we doing? There you go. All right, we're gonna move over there for dissecting the case. Okay.
Alright, so I'm sorry. We can just write that there is both of them have a bullet to the head.
They're both female. They both were in the Army, correct?
Yes, at the Naval
Nursing
Care. Yep.
Both had brain injuries, but they are 2 different brain injuries actually.
Same drug. Same infinity or negative infinity, I'm sorry.
Their branding was the same.
They're both female in the Naval Nursing Academy. 2 different brain injuries, but they both had the same drug and brand in them.
Excuse me, guys. We got to run to a meeting right quick because we got the information from the doctor. All right. First, we got Robin. And Kim. They were both soldiers in the Army. They both received the same battlefield bombing at the same time. They said that they have some sort of relationship with Sergeant Ford.
Okay.
So we should check out that.
Yeah, we need to get in contact with him and see where his base is. Alright, who's going to take that?
I will.
Okay.
So I guess when you just go up to him, just do the same thing, ask him a few questions, see what's up with him, catch up on anything that's weird.
Okay? Alright.
Everything together. Victim 1, victim 2. If you see anything, please tell us if anything else that you found to this too.
Well, now we know that they both have relations with the same guy.
So why don't someone have
Oh, it's right.
And you guys said his name was what?
Sergeant Ford.
And did you say anything else about him?
He wasn't one of her patients.
Oh, he wasn't?
Okay.
So they're both of her patients?
Yeah,
Same?
both of the victims were her patients, and Sergeant Ford wasn't.
Okay.
Do we have the female ages? The age?
I'm going to say 20s, 30s.
20s, 30s.
We haven't got the full autopsy report back on that.
Alright, and we do know they both do have the negative infinity sign.
Yeah.
So that definitely links them. And the bullet to the head. I'm going to say this does mean something. So if someone wanted to
dissect, like, I think we need to go meet Sergeant Thompson, that was her name?
Yes.
I think we need to go question her again.
Alright, I'm probably going to send it to Marilyn.
So I just spoke to the chief of police, and it seems that our suspect has been found dead with the same infinity mark and the same gunshot wound to the head.
Did you get to talk to anybody?
Well, I've been speaking to people around base, and they've been saying that he's been seeing Sergeant Thompson for a brain aneurysm in the past couple weeks.
But hold up, didn't she say that person wasn't?
She told us that person wasn't her patient.
So we need to go back to her.
So she's lying. And then you said that he had the same, what was it on him? The same
Infinity
marking?
mark on the upper
And the
thigh
gun?
and the
So we
same
can
gunshot
that's
wound to the head.
A gunshot wound to the head, and he had a brain injury.
So somebody needs to go back.
So Kevin
Same
and Keenan,
people.
you guys want to go back?
Yeah.
All right.
You need to find out what's going on with that.
Someone has some explaining to do.
Now we got a warrant.
Yep.
Dr. Thompson's house, clearly there's a lot of illegal drugs that don't belong in this house.
And that crushed up powder looks like it matches exactly what I have for my evidence.
This pill, I've seen it before. This is a paralyzing drug that neuroscience surgeons use to paralyze their patients. So that way they would calm down during their visit to Dr. Thompson.
I definitely think this is enough evidence to at least get her arrested and into custody.
I think we have to take samples of all these bloods. This one's probably going to match Ford. This one, that'll probably match our other two victims. It's a shame. It's a shame that things like this has to happen.
Come in.
Why you lie to us?
I didn't lie.
Yes, you did.
I didn't lie.
We asked you simple information.
I don't know what you're talking about.
We asked you if Sergeant Ford.
No!
Why you... Calm down. We just asked you simple information. Hold your second call. Hello? Yes?
Kenil, we're at the crime scene and there's blood scattered everywhere and there's pills crushed up. We think we have our suspect and it's Sergeant Thompson.
Alright, I got you. We will,
Okay, make sure you arrest her before she kills somebody else.
Okay. Got you. We have your arrest for...
I didn't do it! I didn't do it!
You got...
I didn't do it! No! 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 No!
Okay, you had the right to remain silent.
Sometimes our heroes become the ones who fall the fastest, and when you look behind the cover of the book, you may find the truth of the story. It beat twice.
Oh my God.
We have a warrant for you to search for your house.
Why? I didn't do anything.
We suspect you as a criminal for the
You don't know.
Okay, you had the right to remain silent.
I didn't do it!
Anything you say will be used against you in a court of law. You have a right to an attorney. You cannot afford an attorney, one will be appointed to you. Do you understand these rights?
Yes.
Okay.
And then.
Shh.